is Emma from Salmonella Place, and today we're going to be talking about the external carotid and its branches. So what we're going to do is we're going to remove the first layer of skin and also get rid of the muscle, because what we want to just have a look at now is the arteries of the face, of the head and neck. Now the external carotid is the artery that supplies the head and neck region. And I'm just gonna quickly zoom in here to show you and get rid of the skull so I can show you right here. It originates from the common carotid, which is this artery that you see here. This artery here. It originates from the common carotid, and this is the common carotid, and it originates from the bifurcation of the common carotid here at C4. So when the common carotid bifurcates, it bifurcates to give us the internal carotid, which is what you see here, and on the outermost part is the external carotid here. Now, a nice mnemonic that I like to use when I'm trying to remember the branches of the external carotid is a mnemonic which says, some anatomists like flirting while others prefer S&M. I know that sounds a bit funny, but it really does help. So once again, some anatomists like flirting while others prefer S&M, and this stands for the branches of the external carotid, which are the superior thyroid artery, the ascending pharyngeal artery, the lingual artery, facial artery, the occipital artery, the posterior auricular artery, the superficial temporal artery, and finally the maxillary artery. And we're just gonna quickly look at these arteries on our model here. So here we have a model showing us the veins and arteries of the head and neck. And once again, I'm just going to get rid of the skull so we can see the arteries a bit more clearly and zoom in. So here, when I zoom in, one of the first branches that we're going to see here is the superior thyroid artery, and this is this artery right here. I don't know if you can see it right there. I'm going to try and move in more closely so you can see it a bit better, right? So we've just zoomed in, and I'm just going to point that out again. This artery right here, right the tip of the arrow, you can see I'm just going to run down it. It's going kind of down there. That is the superior thyroid artery. So the superior thyroid actually gives the supply to the larynx and the thyroid gland. To know if we can actually see that here. So as you can see here, we have the superior thyroid going down, and there we have the larynx. I'm just going to zoom out. We have the thyroid gland here, as you can see it right here. So it supplies this right here, the thyroid gland, and also the larynx. The next artery that we should be able to see here is the ascending pharyngeal artery, and this should arise from the medial side of the external carotid, and it should arise from the medial side of the external carotid, just above the superior thyroid, so somewhere around there. Unfortunately, in our model here, we don't really see the ascending pharyngeal artery, so it should arise on the medial side, so somewhere around there. And after the ascending pharyngeal artery, the next artery that we should be able to see is the lingual artery, and this is the second anterior branch of the external carotid. Once again, unfortunately, in our model, we don't see the lingual artery, so the lingual artery should be an anterior branch, so coming off somewhere about there. And this artery actually supplies the tongue as well as gives blood supply to the plexus and also to the tonsils. So after the lingual artery, the next artery that we're going to see here is a very important artery, which has many branches as well, and this is called the facial artery. So the facial artery is this artery right here, and as the name implies, it supplies the facial region. And it's actually quite an important artery because I'm just going to see if I can isolate the facial artery here by just clicking on it so we can look at it. So this is the facial artery. I'm just going to rotate that. And as you can see, the facial artery has a number of branches going down the face, these ones that I'm highlighting here. And importantly, this branch here is called the angular artery. And the angular artery is important because it is the artery that allows for the external carotid to form an anastomosis with the internal carotid. So the angular artery is going to anastomose with a branch of the internal carotid called the ophthalmic artery, and this anastomosis in the angle of the eye is what gives us the connection between the internal carotid and the external carotid. So now we're going to look at the next branch of the external carotid, and to do that, we're going to have to rotate the body and look at the posterior aspect, because our next branch actually arises from the posterior aspect of the external carotid. I'm just going to remove the skeleton briefly just so we can have a look at it in an isolated form, and it's this artery right here that we're isolating, this artery that goes all along the posterior aspect of the skull, as we can see here. And this is called the occipital artery. So I'm just going to point at it. Right here at the tip of the arrow is the occipital artery, and as you can see, it runs along the posterior aspect of the skull. So just there we go. On the posterior aspect, as you can see, as I'm rotating, we were looking at it anteriorly before, and now once we rotate it and look at it from the posterior aspect, you can see the occipital artery running along the posterior aspect of the skull and also giving off branches. Then to look at the next artery, once again, I'm just going to rotate the skull backwards, or forwards rather, and we're going to look at it from the side, from a side view of it. And the next branch that we're looking at, the next branch of the external carotid, is the posterior auricular artery. And I'm just going to try and highlight that right here, point at it. Once again, at the tip of my arrow that I have so elegantly drawn is the posterior auricular artery right here. And as you can see, it runs along with a vein, and I'm just going to try and see once again if I can isolate that for you so you can see. So there you go. We see the posterior auricular and some of its terminal branches. And the next artery that we're going to look at is this artery right here that I've just isolated, and this is actually a terminal branch, one of the terminal branches of the external carotid. This artery right here, and this is called the superficial temporal artery. And as you can see, it's just running along here and along the side of the skull. And these are the terminal branches. So it is one of the terminal branches of the external carotid. And the superficial temporal artery actually can be involved in an inflammatory autoimmune disease called temporal arteritis. It's kind of a tongue twister. So an inflammatory autoimmune disease called temporal arteritis. And patients suffering from this autoimmune disease often experience headaches, and this is usually in elderly males. And the next artery that we're going to look at here, if we can find it here, see, kind of try to isolate it, there we go. And this is the final terminal branch of the external carotid, and this is the maxillary artery, which is this artery here, the maxillary artery. And this is a terminal branch, while the external maxillary artery rises more anteriorly. And then we have another part, which is the internal maxillary artery, which is more interior, I guess, and is the terminal part of the maxillary artery. And basically, the whole maxillary artery is another terminal branch of the external carotid artery. As you can see here, I'm just going to rotate it, so we're looking at it and this from two different aspects. There we go, of the maxillary artery, and this supplies the maxilla. So there we go. Those are the branches of the external carotid, and I'm just going to quickly go over the mnemonic that I talked about in the beginning, which is: some anatomists like flirting, others prefer S&M. Some standing for the superior thyroid artery, anatomists standing for the ascending pharyngeal artery, like standing for the lingual artery, flirting, which stands for the facial artery. And remember, the facial artery is important because of that anastomosis that we were talking about between somewhere around here, between the internal carotid and the external carotid through their branches, the branch of the external carotid being the angular artery here, branching from the facial artery, and then a branch from the internal carotid being the ophthalmic artery, and those form an anastomosis between the internal and the external carotid. And just to continue with the mnemonic, others standing for the occipital or the occipital artery that we see in the back here, this artery right there. And the rest of the mnemonic, prefer, which stands for the posterior auricular artery, which we can see right here, just over there. And then S standing for the superficial temporal artery, which you can see rather clearly over here, the superficial temporal, and finally M standing for the maxillary artery, which we can just about see over here in our model. There we go. And those are the branches of the external carotid.